Mastering safety and emergency procedures is the key to passing your CNA state boards. We've narrowed it down to the top 25 exam-focused questions you're guaranteed to see. Focused, fast, and effective. Ready? Let's dive in.
Question 1. A resident's clothing catches fire in the hallway. What is the CNA's first action? A. Use fire extinguisher. B. Stop, drop, and smother flames. C. Pull alarm and evacuate. D. Call the family. Correct answer is B. The first priority is to stop the burning process immediately. Smothering the flames removes oxygen and prevents the fire from spreading further. Once the flames are controlled, the CNA should activate emergency procedures and assess the resident for injuries such as burns or breathing difficulty.
Question 2. You smell smoke and see light smoke coming from a closed linen room. According to fire response priorities, what should you do first? A. Open door to check. B. Start documentation. C. Close door and move residents. D. Wait for flames. Correct answer is C. Closing the door helps contain smoke and limits oxygen from feeding the fire. Removing residents from danger reduces the risk of smoke inhalation and injury. Fire safety protocols always prioritize resident safety before investigation.
Question 3. A small trash can fire starts in a resident room. The nurse tells you to use the extinguisher. What is the correct technique? A. Push and spray randomly. B. Alert and evacuate. C. Pull, aim, squeeze, sweep. D. Shake before use. Correct answer is C. The correct method for using a fire extinguisher is pass. Pull the pin, aim at the base, squeeze the handle, and sweep side to side. Aiming at the base is important because that is where the fire originates. Always keep a clear exit path behind you while using the extinguisher. Question 4. A resident collapses and is unresponsive. What should the CNA do first? A. Give water. B. Check response and call for help. C. Move to bed. D. Look for chart. Correct answer is B. The first step in any emergency is to assess responsiveness and activate the emergency system. Immediate reporting ensures rapid medical intervention. Moving the resident without assessment could worsen potential injuries. Question 5. During feeding, a resident suddenly cannot speak and is clutching their throat. What is the CNA's best immediate action? A. Keep feeding. B. Give water. C. Lay flat. D. Call for help and give thrusts. Correct answer is D. Inability to speak indicates a complete airway obstruction. Immediate choking intervention is required to restore airflow. Delaying action can quickly lead to unconsciousness and serious complications. Question 6. A resident is coughing forcefully after taking a bite of food but can speak. What should you do? A. Encourage coughing and monitor. B. Perform thrusts immediately. C. Sweep mouth with fingers. D. Give water quickly. Correct answer is A. If the resident can cough and speak, the airway is only partially blocked. Encouraging coughing allows the body to clear the obstruction naturally. Abdominal thrusts are only used when the airway is completely blocked. Question 7. You find a resident on the floor next to the bed. What is the CNA's priority? A. Lift quickly. B. Offer snack. C. Assess and call the nurse. D. Clean room. Correct answer is C. A fall may cause hidden injuries such as fractures or head trauma. The resident should remain still until assessed by licensed staff. Prompt reporting ensures proper evaluation and treatment.
Question 8. Which situation requires the CNA to keep the bed in the lowest position as a safety priority? A. Eating in bed. B. High fall risk. C. Reading quietly. D. Bed bath. Correct answer is B. Residents at high risk for falls are safer when the bed is in the lowest position. This reduces the chance of serious injury if they attempt to get up alone. Bed height should only be raised temporarily during care.
Question 9. You see a puddle of clear liquid on the floor near a resident's bathroom door. What is the best action? A. Ignore it. B. Tell residents to be careful. C. Walk away. D. Block area and clean. Correct answer is D. Wet floors are a major cause of falls in healthcare settings. Blocking access prevents immediate injury. Cleaning the spill promptly maintains a safe environment for residents and staff.
Question 10. A resident's oxygen is in use. Which action is most important for fire prevention? A. Cover tank. B. Turn oxygen up. C. Keep away from heat and flames. D. Apply petroleum lotion. Correct answer is C. Oxygen supports combustion and increases fire intensity. Keeping oxygen equipment away from heat sources reduces the risk of ignition. Petroleum-based products should also be avoided near oxygen use.
Question 11. A resident has chest pain, looks pale, and is sweating. What should you do first? A. Give snack. B. Encourage walking. C. Finish task. D. Stay, rest, call nurse. Correct answer is D. Chest pain with sweating may indicate a heart attack. The resident should remain calm and still to reduce strain on the heart. Immediate reporting ensures rapid medical intervention.
Question 12. A resident shows sudden facial droop and slurred speech. What is the CNA's best action? A. Call help and note time. B. Wait. C. Give shower. D. Give food. Correct answer is A. These are classic signs of a stroke. Time is critical for stroke treatment, so noting the onset time is important. Immediate reporting can significantly improve outcomes. Question 13. A resident is having a seizure in bed. What should you do? A. Put object in mouth. B. Protect and turn to side. C. Hold down. D. Give water. Correct answer is B. The goal during a seizure is to prevent injury and protect the airway. Turning the resident to the side helps prevent aspiration. Objects should never be placed in the mouth.
Question 14. A resident's feeding tube becomes disconnected and formula is leaking. What is the most appropriate action for a CNA? A. Reinsert tube. B. Ignore. C. Clamp if allowed and report. D. Keep feeding. Correct answer is C.
CNAs should not reinsert feeding tubes. Clamping the tubing, if permitted, prevents leakage and contamination. Reporting ensures proper medical evaluation.
Question 15. You accidentally stick yourself with a used needle while cleaning up after a procedure. What should you do first? A. Hide it. B. Apply lotion. C. Wash and report immediately. D. Wait. Correct answer is C. Immediate washing reduces the risk of infection. Reporting ensures proper follow-up testing and treatment. Prompt action protects both the employee and patients.
Question 16. A resident's call light is ringing repeatedly, but you are transferring another resident. What is the best safety choice? A. Leave resident. B. Secure resident or ask for help. C. Ignore. D. Turn off remotely. Correct answer is B. Leaving a resident mid-transfer increases fall risk. The current resident must be secured first. Asking for assistance ensures both residents remain safe. Question 17. Which situation is most likely to require do not attempt to move the resident until assessed? A. Asking for water. B. Changing TV. C. Blanket request. D. Possible head or hip injury. Correct answer is D. Moving a resident with suspected fracture or head injury can worsen the damage. The resident should remain still until assessed. Proper evaluation prevents further harm.
Question 18. During a transfer, the resident starts to fall. What is the safest CNA response? A. Guide to floor safely. B. Lift upright. C. Twist and pull. D. Step away. Correct answer is A. Trying to catch a falling resident may cause injury to both parties. Guiding the resident safely to the floor reduces impact. This is proper body mechanics technique. Question 19. A resident with dementia is heading toward an exit door and seems determined to leave. What should you do? A. Yell. B. Lock alone. C. Restrain. D. Redirect and notify nurse. Correct answer is D. Redirection is the safest and least restrictive approach. Yelling or restraining may increase agitation. Reporting ensures proper monitoring and intervention.
Question 20. A resident's room is cluttered with equipment in walking paths. Which correction is most important? A. Turn off lights. B. Clear pathways. C. Add chairs. D. Ignore. Correct answer is B. Clutter increases fall risk significantly. Removing obstacles improves safety and mobility. Environmental safety is part of CNA responsibility. Question 21. Which action best prevents electrical injury when using equipment? A. Overload outlet. B. Use wet hands. C. Tape broken cord. D. Check cords and keep dry. Correct answer is D. Damaged cords and moisture increase the risk of electrical shock and fire. Equipment should always be inspected before use. Unsafe equipment must be reported immediately. Question 22. A resident becomes short of breath and anxious while walking. What is the best CNA response? A. Keep walking. B. Give food. C. Stop, sit, call nurse. D. Leave.
Correct answer is C. Stopping activity reduces oxygen demand and prevents collapse. Reporting ensures medical evaluation. Shortness of breath can signal serious complications. Question 23. When should a CNA complete an incident report? A. Only if family asks. B. After resident is safe. C. End of week. D. Before care. Correct answer is B. Resident safety comes first in any situation. Documentation should follow once the resident is stable. Incident reports help prevent future occurrences.
Question 24. In the CNA curriculum, what does the acronym RACE stand for during a fire emergency? A. Remove, activate, call, exit. B. Rescue, alarm, contain, extinguish. C. Run, alarm, close, escape. D. Rescue, assist, control, evacuate. Correct answer is B. RACE is the standard fire safety protocol taught in CNA training. It stands for Rescue Anyone in Immediate Danger, Alarm by activating the fire alarm system, Contain the fire by closing doors and windows, and extinguish the fire if it is small and safe to do so, or evacuate if necessary. This order helps protect residents and prevent the spread of fire.
Question 25. In a disaster evacuation, what is the CNA's most important responsibility? A. Follow emergency plan. B. Leave early. C. Choose own route. D. Continue routine care. Correct answer is A. Facilities have established emergency procedures to protect residents. Following the plan ensures coordinated evacuation. Staying calm and organized prevents injury and panic. That's 25 more exam-focused questions in the back. How did you do? Drop your score in the comments below. Don't forget to subscribe for more high-yield MCQ practice to help you pass your state boards on the first try. Happy studying!